training our
We have
medical
also
staff
increased
across the
diagnostic capabilities.
We have also increased
Within 2 months,
diagnostic capability.
we moved from
Within 2
one
months,
major facility
we moved
for
from
pan-India testing
one major
to
facility
more than
for pan-India
66
testing
such
to
labs.
more than
And
66
we have developed
such labs.
protocols
And
for
we
each
have
stage
developed
of managing
protocols
this
for
pandemic.
each stage
Of
for
managing
screening
this pandemic.
entry points,
For screening
contact tracing
at entry
of
points,
suspected cases,
contact tracing
quarantine
of suspected
and
management
cases,
of isolation facilities,
quarantine
and management of
for
isolation
discharge of
facilities,
cleared cases.
and
We
for
also
discharge of
responded
cleared cases.
to the call of
We also responded to the call of our people abroad. We evacuated nearly 1,400 Indians from different countries. We also similarly helped some of the citizens of our neighboring countries. We have now built a protocol for such evacuations, including carrying out testing by our mobile teams deployed abroad. We recognize that other countries would be also concerned about their citizens in India. So, we briefed foreign ambassadors about the steps we were taking. Excellencies, we fully recognize that we are still in an unknown situation. We cannot predict with certainty how the situation will unfold despite our best efforts. You must also be facing similar concerns. This is why it would be most valuable for all of us to share our perspectives. I look forward to hearing your views. Thank you very much. I now request His Excellency President Ghani to share his thoughts with us.
Thank you, Mr. Prime Minister, and best wishes to Prime Minister Oli. And thank you for taking this very important initiative. All that is normal is disrupted, and all that seems solid is melting into thin air. We are into unknown territory, and our vulnerability, Excellency, comes from our openness. Our greatest vulnerability is that we have an open border with Iran, one of the major centers, and the flow cannot be stopped. And the province of Iraq is become the central node for preventing the spread and diffusion of this deadly disease to the rest of South Asia. I have the following 5 proposals. 1, modeling of diffusion impacts and scenarios for management. Unless we model the diffusion, we will be facing assumptions from China or the United States or Iran are not suitable to our situation. I request the task force of SAARC to be able to do this. Second, telemedicine, because the second and third order impact of this, particularly on poor and vulnerable in women, is very significant. If we could create a common framework for telemedicine for diagnosis of related issues and as advances take place, how to be able to coordinate. Third, as a landlocked country, which is simultaneously the heart of Asia, closing of borders where essential will result in significant problems regarding availability of medicine, food, and basic goods. Can we coordinate to be able to create controlled flows that both allows transactions to take place while focusing on the essentials? The food issue for us, Excellencies, because, in all Excellency, because we've cancelled schools, prayers have been stopped. How do we keep women, youth, and children occupied? Since India in particular and South Asia are leaders in distance education and self-learning, can the SAARC satellite and India's satellite be made available so we can keep people, because social distancing that is necessary cannot just take place. In my fifth proposal, Prime Minister, distinguished Prime Minister, since India is both a very important member of SAARC and a member of the Shanghai Council, Cooperation Council, in Shanghai, both with China, that is our deepest sympathies, in Iran. Can we coordinate between SAARC and the Shanghai Cooperation Council through your initiative? How much of the experience of China is replicable to our situations, and how do we both learn and help Iran? I thank you again for this opportunity. Our conditions, being one of the poorest countries and conflict prone, require learning, particularly from how you upscale the existing program. We have a program across the country called HELP, that is basic health, and if there are other countries that have upgraded their basic systems to cope with this, we'll be extremely grateful for learning and yet sharing our experience. Thank you, Excellency.
Thank you, Excellency. I now request His Excellency President Soli to make his remarks.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon. I too wish to begin by thanking Prime Minister Modi for this timely call for a regional initiative to combat the increasing threat of COVID-19 in the SAARC region. In times of crisis, we do come together. In 2003, for example, when the region faced the threat of SARS, the Maldives took the initiative and hosted an extraordinary meeting of SAARC health ministers that adopted a regional common strategy for tackling the virus. No country on its own can succeed in combating the virus. It requires a shared response at an unprecedented scale. The first COVID-19 case was confirmed in the Maldives on 7 March. To date, there are 13 confirmed cases. Fortunately, no deaths so far. Since January this year, the Maldives has been taking steps to get ready for a possible outbreak. We set in place standard operational procedures and facilities for treatment and quarantine in various islands. In the event of major outbreak in the country, our health facilities will have to cope with the care needed for both our residents and the thousands of tourists who visit the Maldives every year. Our priority now is to use precautionary measures to contain the virus as much as possible so as not to overburden our limited resources. The unique geography of the Maldives will always present itself both as an opportunity as well as a challenge. The dispersed islands make it easier for us to isolate communities whenever there is a suspected case. But in the event that a person tests positive in the outer islands and is seriously ill, requiring specialist care, the person has to be transported to the capital, Male. This is extremely costly and puts enormous pressure on an overstretched team of healthcare workers. The tertiary hospitals in the regions are currently under development. Shortage of healthcare professionals in general and shortage of specialist doctors in particular are always major challenges, and in a crisis such as this, these challenges are several times greater. The Maldives is fortunate to have received general assistance from India, and I convey my government's appreciations to Prime Minister Modi and the people of India. We have received medicine and a visiting medical relief team to work with Maldivian healthcare professionals. Excellencies, in the Maldives, the virus is showing in the most destructive measure the country's vulnerabilities to external shocks. Tourist arrivals started to decline considerably several weeks before the first case was reported. In February this year, arrivals declined by 14.3%. And in the first 10 days of this month, arrivals have already declined by 22.8%. The decline in tourist arrivals has now become so sharp that if the current trend continues, we will have a 35% drop this year. Any significant decline in tourist arrivals has a ripple effect on the Maldives economy. Tourism contributes over a quarter of the country's GDP and is the source of well over 2/3 of foreign currency to the country. Every other job creating and revenue generating activity in the country is either directly or indirectly dependent on the tourism industry. Our industry is also deeply linked to many businesses and supply chains within SAARC region who will feel the knock-on effects from the downturn in the Maldives. China and Italy are the most severely affected countries of the virus, and they are also the number 1 and number 3 source markets for Maldives tourists. Since the beginning of February, in the case of China, and March in the case of Italy, arrivals from these two countries have been restricted. As a result of this decline, the Maldives is now facing a serious shortfall in foreign currency earning, estimated to be at $450 million. If the foreign currency shortfall continues, it will have a detrimental impact on the Maldives economy, which has an extremely high dependency on imports. The revenue and foreign currency shortfall are also seriously hampering the government's ability to respond to COVID-19 rapidly. The decline means serious shortage in total government revenue. Current estimates show that if tourist arrivals continue to decline, Maldives will be looking at a shortfall in government revenues between $135.9 million and $446.6 million this year. I am therefore in full agreement with Prime Minister Modi on the need to formulate a comprehensive regional strategy. Such a strategy should we believe comprise three key elements. First, we should create space for closer cooperation between the health emergency agencies to ensure that the countries in SAARC have unhindered exchanges of information about the virus and best practices. Second, there is a profound need to formulate an economic relief package targeted to the affected countries. Third, a comprehensive regional strategy to fight COVID-19 should include a long-term recovery plan for the region. I will be happy to speak further on these elements in the discussion. Thank you, Prime Minister Modi.
Thank you, Excellency. Now I request His Excellency President Rajpaksha to share his thoughts.
Good evening, Excellencies. First, I must thank Honorable Prime Minister of India, Shri Narendra Modi, for initiating this video conference to share our experiences, our ideas and best practices, and also to understand the challenges we face and further discuss what measures to be taken to combat this deadly coronavirus. Our biggest challenge is to stop or minimize the virus entering into Sri Lanka and control the spreading of the virus within. Following the guidelines and statistics relating to the spread of the virus issued by the World Health Organization. We have also taken steps because we have a large number of Sri Lankans working especially in Italy and South Korea. We cannot stop our Sri Lankans coming back to their home country. We have therefore taken all steps to subject those returning to Sri Lanka to a 14-day quarantine period in selected quarantine centers. As it is important to restrict social gatherings, we have advanced the usual April school holidays to commence from 11th March. Further, we have closed all universities and other educational institutes, also with the aim of minimizing social interaction. Our first case was reported in Sri Lanka, was a Chinese lady tourist who since has been cured and already left Sri Lanka. The first Sri Lankan to be infected was a tour guide who had contracted the virus from a few Italian tourists who have already left the country. At present, we have 11 cases being treated in the hospital. There have been no deaths reported so far. We have a specialized infectious diseases hospital, IDH, close to the city, Colombo, with intensive care facilities. This hospital has successfully treated even the first case reported. In all other hospitals designated to treat any suspected cases or coronavirus cases, proper personal protective equipment is used. We have also requested those who show flu symptoms to seek urgent medical attention and also self-quarantine themselves. Close associates of these persons showing any flu symptoms have also been strongly advised to be subject to self-quarantine. The area police and the public health inspectors are closely monitoring the progress of the suspected patients. Public health inspectors undertake daily visits to check on these persons who are self-quarantined. We have also established a national task force comprising all major stakeholders with the power and authority to take crucial decisions have been set up and meet on daily basis with close and constant monitoring of all aspects relating to the spread of this deadly virus. A 24/7 office with hotlines has been established to coordinate all activities related to battling the spread of the virus, quarantine and testing and treatment of suspected and confirmed cases. Government of Sri Lanka has taken some additional steps to effectively meet this unforeseen disaster. The Department of Health started giving out health warnings and advice on precautionary measures needed to be followed for prevention of the spread of the virus. This is done through mass media, presidential media division, press briefings, press bulletins, etc. General public were educated not to go for panic buying of face masks, hand sanitizers, etc. This was quite effective. 12 hospitals were declared as suitable for caring of possible coronavirus affected cases across the country. Managing of stocks of personal protective equipment such as masks, gloves, sanitizers and other medical items required for treatment of patients also started. Since the high risk area for the coronavirus was the city of Wuhan, Hubei province in China, there was a requirement to evacuate 34 Sri Lankan students and their families back to Sri Lanka. This was done by the national carrier Sri Lanka Airlines, which flew from Colombo to Wuhan and back to Colombo with all 34 passengers. These 34 students on arrival were immediately quarantined by the Sri Lanka Air Force before they were taken to a military facility in the Central Hills for quarantine for 14 days under the supervision of the Army medical team. None of them contracted the virus and all were sent home on completion of the 14 days quarantine period. At the same time, another 750 Sri Lankans were studying in various universities in different provinces of China and the government facilities. They were returned back to Sri Lanka. These students were instructed to be self-quarantined for 14 days under the supervision and monitoring by local health authorities. As As you know, probably that our parliament has been dissolved on 2nd March, and the general elections will be held on 25th April. So the nominations are being accepted from 12 March up to 19 March. Therefore, we have to take precautions to discourage large meetings, large gatherings. But the elections will be held as planned. When the World Health Organization, WHO, declared COVID-19 pandemic and indicated that fundamental public health interventions can still limit the spread of the virus and drive down cases even where it was transmitting widely. Advisories were issued for travelers, and precautionary measures were taken by limiting travel overseas of Sri Lankans unless it is essential to do so. Almost all major sporting events, international conferences, meetings, large gatherings have been postponed or cancelled. All schools, universities and other educational establishments, including preschools throughout the country, has been closed for particular periods ranging from 2 weeks to 6 weeks. Even gatherings for religious purpose have been stopped by respective religious leaders, initially for 2 weeks. Also, issuance of on-arrival visas has been suspended for all countries. Travel advisories sent to airlines not to uplift passengers from several countries, mostly from EU countries. Travel advisories also sent that any passenger coming from countries which we have defined will be quarantined for 14 days in Sri Lanka. Sanitizing of public transport also commenced from 2 days back. So because of these reasons, our economy has taken a severe blow due to the coronavirus, particularly in tourism. Most of our tourists are from Italy, Germany and other EU countries. And now there is a ban on the honey. Our tourist industry was just recovering after last year's April 21st terrorist attack. Our exports are also adversely affected. Therefore, I strongly recommend the SAARC leaders to formulate a mechanism to assist our economies to tide over this very difficult period. I also wish to recommend that a SAARC ministerial level group be established to discuss, share best practices and coordinate regional matters on combating coronavirus. Thank you, Excellencies.
Thank you, Excellency. I now call upon Her Excellency Prime Minister Sheikh Hasina to share her thoughts.
Thank you very much. Good afternoon to all the SAARC leaders. First of all, I thank Prime Minister Modi for taking this initiative. I also thanks for bringing and hosting 23 of our students from Wuhan along with Indian students during the quarantine period. We need to devise a strong third-world strategy to fight this public health threat and to protect our citizens. We successfully prevented entry of the virus through strong surveillance and rigorous checkup at all international airports, seaports, and land ports. As of now, we have only 3 COVID-19 imported cases. They have already recovered. There are 2 new imported cases from Europe. We have no local or community transmission of any COVID-19 case. We have set up a national committee to provide guidance to concerned people from all ministries at all levels. We have also undertaken massive awareness raising campaigns everywhere in Bangladesh through all available medias, including social media. My party workers at all levels are active in awareness raising. Local body representatives are vigilant to enforce home quarantine if necessary. We have kept 4 newly built hospitals, including the Kuwait Mantri Hospital in Dhaka, dedicated to exclusively deal with COVID-19 patients. In addition, there is one more hospital in Russia to exclusively handle COVID-19 patients. We have also earmarked separate beds in every hospital in all districts to treat COVID-19 patients. A few vacant buildings have been identified where makeshift hospitals can be established in case there is any such need. We also have trained health workers at Upazila levels. School children are also being trained to follow necessary personal hygiene. We have stockpiles of testing kits, infrared thermometers, isolation gowns, and masks. Excellencies, I have some proposals that all SAARC countries need to cooperate and collaborate closely to fight this pandemic. We need to force collaboration through our collective capacity, expertise, and resources. We are ready to share our capacity and expertise as well as the best practice with the SAARC countries, including providing logistic support if required. To continue this dialogue at technical level, our health ministers, health secretaries, and relevant health experts can also have this kind of video conferences to discuss specific areas of cooperation. WHO Southeast Asia Regional Director may be invited to these video conferences. We believe it is extremely important to establish an institution to prevent and fight against any public health threats in South Asian region in future. In our SAARC Charter, it is already there about the healthcare. So we can work together for future, and in future any problem arise, we can work together and we can exchange or share our experience. And Bangladesh will be happy to host such institution if you all kindly agree. Excellency, I really thank you very much, especially Prime Minister Modi, to take the initiative, and also I appreciate that after a long time all the SAARC leaders get together. So it's a very crucial time for all of us. So we have to think about our people's goodwill. So I hope that this will show a new dimension our path to help our peoples of all our country and all the region. Thank you very much.
Thank you, Excellency. I now request His Excellency Prime Minister Oli to make his remarks.
Right Honorable Prime Minister Sri Narendra Modi ji, distinguished heads of state and government of SAARC member states, Namaste and good afternoon. First of all, I would like to thank Prime Minister Sri Narendra Modi ji for taking this important and timely initiative, which I warmly welcome. Our collective wisdom and efforts will help us devise a sound and robust strategy for the SAARC region as we fight the COVID-19 pandemic. I wish to thank Prime Minister Modi ji and all the distinguished leaders of SAARC member states for kind words and best wishes on my speedy recovery. Even though we had detected one suspected imported case, but the COVID-19 test proved negative. Yet we are aware of the high risk of possible outbreak at any time. We remain alert from preventing it. We have taken several measures to enhance our preparedness. Our efforts at the moment are geared towards preventing this disease to enter into our country. Our national efforts, I am personally overseeing and guiding the government efforts. Multi-agency coordination committees have been set up at the center, provinces and local levels to mobilize government efforts in the synergetic manner. We have restricted international movements. Visa on arrival facility for all foreigners and non-resident Nepalis with foreign passport has been suspended. Movement of this country, movement of third country nationals via land routes has been suspended. Swab test PRC health certificate is made mandatory to obtain visa from Nepali missions abroad for essential travels to Nepal. We have suspended issuance of work permit for Nepali nationals for overseas employment. International passengers are required to go through the screening process at the health desks at the international airport. There are provisions for self-quarantine for certain categories of travelers. We are strengthening quarantine facilities in all provinces, hospitals, and arranged isolation wards and intensive wards for treatment. We are enhancing capacity of hospitals. Health workers are being provided with personal protective equipment and necessary incentives to motivate them. All the permits for mountaineering expedition for spring 2020 have been suspended and all major international conferences have been postponed. Okay. Thank you very much.
Thank you, Excellency. Now I call upon His Excellency Prime Minister Dr. Lote Shering, who is an experienced surgeon. Prime Minister Shering, we are all keen to hear you. Please.
Excellency, before I start, I would like to take this opportunity to convey my king's greetings to all the heads of the states and heads of the governments here. As we speak, my king is out of the capital. He is in the district places, ensuring healthcare services, ensuring COVID-19 surveillance system, and trying to motivate our healthcare services and service providers, as well as asking all the people of Bhutan to be on the same page when this pandemic strikes Bhutan. So with this, I also would like to take this opportunity to express my king's greetings and greetings of all of us to Prime Minister Oli for his speedy recovery. And similarly, we also would like to wish Prime Minister Hasina for her father's 100th birthday celebration in few days. So with this, I would like to thank Prime Minister Modi for your excellent leadership to bring all of us together, because togetherness is required at all times. But when the whole world is fighting one common disease that we cannot see with our naked eyes, I think it's very important that all of us come together and leave behind our differences. And number two, I think it is very important that we communicate very clearly on this. Communicate between all the leaders of the world, communicate between central government with local government, communicate with the health planners and the people of the nations. So I think this is very timely, and I would like to thank Prime Minister Modi ji for your excellent leadership on this. To tell my colleagues on the experience of Bhutan on the lone COVID-19 positive that we had, it was the 5th of this month, last 5th of March evening, we had one lone imported case, a Bhutan lover, a Bhutan visitor who wanted to visit Bhutan, came to Bhutan, and then on the 3rd day of his visit, he showed some very abnormal signs, symptoms, and then on suspicion, we found out that he was COVID-19 positive by evening. Yet we wanted to confirm it, and the confirmatory test came just before midnight, around 11:30 p.m. By then, our health officials had all gathered in the ministry. Even my king also came to the ministry, and we all started because we knew that we had the first confirmed positive case. So throughout the night, we worked very hard. Our surveillance system that was already in place was initiated, activated overnight, and starting midnight till 7 a.m. the coming morning, that is 6th of March, we managed to trace the whole path of the first positive case. We managed to identify all the 48 primary contacts. We managed to send all the contact tracers and surveillance team to their respective places and inform them of the importance of house quarantine that first morning. And then as the day unfolded, we managed to pull them out and bring them to the formally identified quarantine facilities. So over 7-8 hours, we managed to identify all 48 primary contacts from 3 different parts of the country wherever our tourists had visited. And we also managed to initiate the medical team that we had identified to treat in case if he had a positive case. And then he was isolated and treatment started. And it all happened because our health ministry under Minister Dishen's leadership, everything was planned beforehand. And then our king was also awake the whole night trying to coordinate the whole thing and bring all the primary contacts together. So we do not wish to have positive cases in any countries, but to have a positive case in this manner and to be able to identify all the primary contacts and isolate them, I thought was a huge success that we brought in. Then starting from there, we managed to treat him, take care of him very, very well, and his family wanted the patient back home. So he was successfully air evacuated day before yesterday, and he reached his hometown last night actually. So we wish him a speedy recovery. All the people of Bhutan send our sincere prayers for his speedy recovery. But the fact is, since as we all know, and as all the heads of the country shared here, this is our uphill task, because we really don't see our enemy. This pandemic that is challenging all of us do not follow geographical boundaries. That's why, as I said, it's very important for all of us to be on the same page. And as we all know that it affects the elderly people, and it affects more people with comorbid conditions. So similarly, the aftermath of this disease will also affect the smaller and vulnerable economies more hardly than the better ones. So we are equally concerned that as we fight and as we try to contain this disease, we are also concerned about the economic outcomes of this disease. So therefore, I would like to support all the proposals that were made before me, and also to be very, very sure that we all will share our limited resources that we have, share the technologies that we have, and also to have frequent such meetings so that with the changes in time and with the changes of the demand of this pandemic, we also come and regroup ourselves. And I also would like to propose that we must have a similar cooperation in economic get up on this issue, because all the smaller economies are disproportionately hit. So with this, I'm sure my other colleagues will have a lot of points to share, and I also would like to contribute as the discussion goes on. So as of now, I would like to thank all the heads of the states and heads of the countries and governments, as well as Prime Minister Modi, for your initiative. Thank you very much.
Thank you, Excellency. Now I call upon His Excellency Dr. Jafar Mirza, who also has medical experience, to share his thoughts.
Bismillahirrahmanirrahim, and Assalamu alaikum to honorable heads of state and government and Secretary General SAARC. First of all, I would like to wish good health to His Excellency Prime Minister of Nepal. Your Excellencies, the COVID-19 pandemic is one of the most serious global health emergencies witnessed in the last 100 years. At the same time, when it has been characterized as a global pandemic, it is deemed controllable as well, provided timely and appropriate public health measures are put in place. With over 155,000 infections, 5,833 deaths, and 138 countries involved, no nation and no region on earth can afford to be unresponsive. Least of all SAARC, which is home to 1/5 of the humanity, several of the world's largest megacities, and many of the most densely populated regions. Pakistan shares the common concern over the potential of COVID-19 affecting South Asia. All our countries now have confirmed cases. Mercifully, the SAARC region has so far evaded the worst ravages, but given the experience of other countries in other continents, there is absolutely no room for any complacency. While hoping for the best, we have to prepare for the worst. The World Health Organization's four-pronged advice offers a reasonable way forward, namely, A. Prevent, B. Detect, C. Respond, and also D. Conduct research and innovation along the way. Excellencies, Pakistan has been involved in containment efforts right from the outset of the outbreak. We have been alert to the dangers and have put in place appropriate public health measures and developed required protocols and guidelines for the safety of our people. We have been matching our measures to real-time risk assessments. While we have stressed the need for prevention and caution, we have strongly advised against panic. A calm, calculated, and deliberate response is the need of the hour. Pakistan was among the first few countries to undertake a joint external evaluation for the state of preparedness to cope with health emergencies in the context of International Health Regulations 2005. In close collaboration with World Health Organization, we have been taking steps to appropriately restrict movement to and from the affected countries, regulate for flights, institute health screening measures at entry points by member states, and establish quarantine/isolation facilities. Diagnosed cases are being isolated and contacts are being traced proactively. Prime Minister Imran Khan is personally overseeing these efforts. Resultantly, Pakistan has managed so far to keep the cases to a relative minimum, an achievement that WHO has recently recognized as a good practice and has commended it. National Security Committee recently convened for the first time on a national health issue, chaired by the Prime Minister Imran Khan, and has decided to take major steps to contain the spread of COVID-19. The 4 pillars of our response strategy include: 1, governance and financing; 2, prevention; 3, mitigation; and D, 4, communication. We have decided inter alia, 1, to close all our educational institutions for 3 weeks, close the entire western border for 2 weeks, restrict international flights to 3 airports only, and to ban all large public gatherings, and reinforce screening and administrative measures at the seaports and at the ground crossings. The situation is being monitored closely, and appropriate measures are being taken through a systematic consultative review process. The National Disaster Management Authority has been mandated to lead the interagency effort, and command and control centers have been established at the federal and provincial levels. Effective coordination and surveillance at all levels is critically important. Excellencies, the COVID-19 pandemic forces us to think not in terms of nations and states, but as a collective. If our health systems, disease surveillance systems, and preventive measures are unable to cope, the human and economic cost alone can be staggering. The cumulative impact will dampen region-wide growth prospects and negatively affect the national development agendas. At their current stages of development, the SAARC members can ill afford such a setback. The unprecedented challenge therefore warrants an unprecedented response. We must recognize that the national and local responses still remain the key, and they are the most critical. It is equally important to pursue, however, evidence and science-based responses. Stigmatization and stereotyping is counterproductive. The SAARC Secretariat is best placed to coordinate regional endeavors. With this in view, Pakistan proposes, like other excellencies, that the SAARC Secretariat be mandated to: 1, establish a working group of respective national authorities for health information and data exchange, as well as coordination for responses in real time. And 2, like His Excellency President of Maldives and Her Excellency Prime Minister of Bangladesh, Pakistan would like to reiterate its earlier proposal of hosting SAARC Health Ministers Conference at an appropriate time. 3, reach out on behalf of SAARC countries to specialized development partners, including World Health Organization, for mobilization for technical advice and resources. 4, follow WHO guidelines and implement exit health screening for travelers in the region to avoid cross-border spread. 5, a regional mechanism is proposed to share disease surveillance data in real time about prevalence and incidence of communicable diseases and public health events of regional significance. And lastly, learn from and disseminate the experience of SAARC observer states, particularly China, which has effectively addressed the COVID-19 challenge despite being from where it originated. Excellencies, the challenge at hand demands sagacity, vision, and synergy of action. The strength and resilience of the people of South Asia is well known. We have no doubt that we will overcome these challenges. Thank you, Your Excellencies.
Thank you. Thank you, Excellency. Thank you all for sharing your thoughts on the situation and the steps you have taken. We all agree that we are facing a serious challenge. We do not know and as yet know what shape the pandemic will take in the coming days. It is clear that we have to work together. We can respond best by coming together, not growing apart. Collaboration, not confusion. Preparation, not panic. In this spirit of collaboration, let me share a few ideas on what India can offer to this joint effort. I propose we create a COVID-19 emergency fund. This could be based on voluntary contributions from all of us. India can start with an initial offer of $10 million for this fund. Any of us can use the fund to meet the cost of immediate actions. Our foreign secretaries, through our embassies, can coordinate quickly to finalize the utilization of this fund. We are assembling a rapid response team of doctors and specialists in India, along with testing kits and other equipment. They will be on standby to be placed at your disposal if required. We can also quickly arrange online training capsules for your emergency response teams. This will be based on the model we have used in our own country to raise the capacity of all our emergency staff. We had set up an integrated disease surveillance portal to better trace possible virus carriers and the people they contacted. We could share this disease surveillance software with SAARC partners and training on using this. Let us also use existing facilities like the SAARC Disaster Management Center to pull in the best practices among all of us. Looking ahead, we could create a common research platform to coordinate research on controlling epidemic disease within our South Asian region. The Indian Council of Medical Research can offer